My name is Matt Saberito, and I am currently a senior biology major and chemistry minor at Quinnipiac University. I am also in the 4+1 molecular and cell biology master's program, ultimately aspiring to be an orthopedic surgeon. For my summer experience, I shadowed Dr. Umar Dasti, whom is a board-certified orthopedic surgeon. Dr. Dasti works out of Ridgewood Orthopedic Group in New Jersey and is affiliated with the Valley Hospital. Part of my experience took place at the Luckow Pavilion, Valley's outpatient surgical center. Here I observed Dr. Dasti perform a couple of procedures such as knee and shoulder arthroscopies, as well as a total shoulder replacement. Being an orthopedic surgeon requires strong teamwork skills. The operating room is composed of a group of healthcare professionals working to achieve the common goal of patient satisfaction. The staff comprises of nurses, scrub techs, physician assistants, an anesthesiologist, and even other types of surgeons as well. One of the major surgeries I observed was a total reverse shoulder replacement. Taking Bio 211 lab with Professor Cologne Lippa proved to be truly useful, as I remembered the muscles as well as where they attach in the shoulder joint. Therefore, I wasn't completely lost when Dr. Desti explained to me that he needed to remove muscles such as the subscapularis and long head of the biceps muscles before removing the head of the humerus and glenoid cavity during the procedure. The majority of the time spent on my summer experience took place at Ridgewood Orthopedics Group, the private group Dr. Dasti works with. Teamwork and communication proved to be a crucial role in Dr. Dasti's life working in a group. Each physician played their own specific role and had their own specialty. For example, Dr. Dasti specializes in shoulder, knee, and hip arthroscopies, while Dr. Rondeck specializes in elbows and hands. Another surgeon, Dr. Crisatello, specializes in the spine. The doctors are constantly assisting each other and referring patients to each other based off their specialties. Another important skill for an orthopedic surgeon is to have good interpersonal skills. As an aspiring physician, I understand the importance of having good bedside manner. I've observed Dr. Dasti relate to patients on a personal level as he remembers what is going on in his patients' lives. This makes him good at relating to his patients, which helps grant reassurance from them. I strive to constantly improve on my interpersonal and cultural skills so I can relate to a wide array of people. Throughout my summer experience, I have been exposed to a vast amount of patients ranging in age as well as ethnic and religious backgrounds. This has expanded my cultural knowledge and allowed me to become a more tolerant person when it comes to contrasting viewpoints. Dr. Dasti knows that there is no cure or course of treatment that works the same on everyone. Therefore, he has to communicate all the possible plans of action with his patients. I remember specifically an elderly man came in with severe hip arthritis and asked what his options were. Dr. Desti explained that there are cortisone injections, gel injections, physical therapy, or total hip replacement. The patient had already tried physical therapy, and Dr. Dasti had explained that there is a chance the cortisone and gel injections will work, but there are varying results. Obviously, the patient was nervous at the sound of total joint replacement, as it is a major surgery. However, Dr. Dasti reassured him that there was a 95% chance of success and full recovery. The patient turned and looked at me and asked my opinion. Caught off guard, this was the first time I had ever been asked my opinion on a dilemma a patient had, and I reassured him just as I had observed Dr. Dasti do so many times before. Ultimately, he needed to take more time to think it through, but a few weeks later he scheduled the surgery. This type of situation taught me that I gained something valuable out of this experience and that I learned how to relate to someone on a personal level and communicate effectively to them by relating to the situation they are in. Overall, this has been an extremely profound experience for me to observe a healthcare professional work collaboratively in his environment. I am thankful for this opportunity for personal growth and exposure to the healthcare field.